Okay. Let's eat. Merienda. Huh? I said I let you eat. Oh, that's okay. Skyflex. Mm.
Good.
Mm.
Have a good lunch.
All right, thank you.
The results on a leukemic patient are as follows. Alpha-naphthyl ASD acetate esterase 3 plus NASTA with sodium fluoride 1 plus. The results are suggestive of which type of leukemia? The results on a leukemic patient are as follows. Alpha-naphthyl ASD acetate esterase 3 plus NASTA with sodium fluoride 1 plus. The results are suggestive of which type of leukemia? Acute myelomonocytic leukemia or AMML. Which of the following is the reagent used for the string test? 0.5% sodium deoxycholate. In the heteroviral antibody test, which of the following constitutes a positive reaction? Agglutination. What is the average lifespan of a platelet?
Kung anong tawag dito.
8 to 11 days. In which of these clinical conditions may blood cholesterol be increased? Hypothyroidism. Oral temp of a donor must not exceed 37.5 C. The following results are observed on an anemic patient. Our positive is N37 none. Warm autoimmune hemolytic anemia. What term describes a substance that minimizes any change in hydrogen ion concentration? Buffer. All of the following sources of error will falsely elevate the erythrocyte sedimentation rate except which one? Polycythemia.
Mm.
Leukopenia can occur in all of the following conditions except which one?
Mm.
Leuknoid reaction. All of the following genera are oxidase positive except which one? Homophilus. Which do a low platelet count and normal bleeding time indicate? Autoimmune thrombocytopenia. Which enzyme is the most sensitive indicator of obstructive jaundice? Alkaline phosphatase.
Stop.
At what stage will specific granules of polymorphonuclear cells appear?
Merienda natin ay Skyflex.
Myelocytes. Which autologous procedure is blood drawn and stored before the anticipated elective surgery? Preoperative collection. Prehepatic bilirubin has which of the following for protein carrier?
Mm.
Albumin. Increases during the convalescence phase of infection. IgG. Standard acceptable color for anti-A grouping serum. Blue. Basic concept of OGG testing included all of the following except which one? OGG is used to detect in vivo sensitization. The total protein is 7.2 grams per deciliter. The serum protein results are as follows. Albumin 53.0%, 3.8 grams per deciliter. Alpha 1 3.6%, 0.3 grams per deciliter. Alpha 2 11.0%, 0.8 grams per deciliter. Beta 17.6%, 1.2 grams per deciliter. Gamma 14.8%, 1.1 grams per deciliter. What is the AG ratio?
Alright. Good. How are
1.1.
you? Busy?
Decreased CSF glucose level. Bacterial meningitis. Which tapeworm eggs have an operculum at one end and a small terminal knob at the other end? Diphyllobothrium latum. Which of the following can be attached to a solid phase support? Antibody or antigen. If pneumococci are resistant to penicillin, then they should be tested for which of the following? Beta-lactamase production. Which one of the following applies to cryoglobulins? They are temperature-sensitive proteins. 2 units of compatible blood for a patnet who has anti-JKA are needed, then how many units should be cross-matched? 10. Criteria for pre-surgical autologous donation is true. Donor hemoglobin must be at least 11.0 grams per deciliter. Diagnostic laboratory test for required immunodeficiency syndrome. Less than 200 CD4 plus T cells. How can the color of right-stained red blood cells be adjusted? Adjusting the pH of the buffer. Which hormone is responsible for the reduction of blood sugar levels? Insulin. Not a class I gene product. HLA-DR. All of the following are characteristic of a bone marrow of Waldenstrom's microglobinemia except which one? Increased megakaryocytes. Substitution of valine for glutamine as a 6th amino acid in the beta chain results in the production of which hemoglobin? HBS. True yeast produce which of the following in the asexual stage? Blastoconidia. The colorimetric method for magnesium employs which reagent? Titan yellow. Which red blood cell shows peripheral rim of hemoglobin with a dark staining central area? Leptocyte. Which statement concerning optical density according to Beer's law is true? It is directly proportional to the concentration. How much should saline needles for the quantitative VDRL test deliver? 100 drops ml. In which special cytochemical stain are homogeneously pink cells counted as positive? Klein-Hauer-Betke stain. Which anaerobic gram-positive rod produces terminal tennis racket spores? Clostridium tetani. Which of the 4 elements in protein differentiates this class of substances from the carbohydrates and lipids? Nitrogen. Which coagulation factors are monitored in severe liver disease? Factors I and V. Thrombocythemia is most commonly associated with which myeloproliferative disorder? Polycythemia vera. How long does the morphological cycle of Rhodococcus equi from cocoid to rod form take? 24 hours. J chain.
Okay. Back to work.
IgM
Babush.
and IgA. The port wine color of some urines can be attributed to which of the following? Porphyrins.